next we have Melissa Engebose, who is going to be talking to us about Neuroscience Nurse Navigator position. She is with the Aurora Stroke Unit.
Hi, I'm Melissa. So I know the Neuroscience Navigator title is one that a lot of people aren't familiar with, mainly because it's very unique. It's even unique within our system. So it's actually a combination of roles. It was a shortened way of saying stroke navigator, spine coordinator is actually what it was. The difference between navigator and coordinator is the navigator position is more all around. They still do patient care. We're still doing bedside work and community, whereas when you get into more of the coordinator role, you're looking at policies and protocols. So I do a little bit of each in each category, and it made it easier to combine them into one role. So that's where the title actually comes from. It's confusing only because it really is unique and we created it. All right, so my career path. So graduating from high school, I had a great plan. I went to UW-Whitewater for a year because I thought I wanted to teach Spanish. Not where I ended up. And like most college students, I took a job to afford college, and I actually found a job that I really loved. I was helping people at night with their nighttime routines, getting into bed. These are people who had high functioning memories, brains worked great, but their bodies didn't always do what they wanted them to do. So people who were quadriplegic, MS, multiple sclerosis, things like that. And I found that I had a passion for that compared to teaching Spanish. And one of my first people that I cared for on my own, 18 years old, had no healthcare experience at that point, and he could tell I was uncomfortable. And what he told me 20 years ago, I actually to this day still remember and use. And he told me, I can tell you're uncomfortable. You should never do something you're uncomfortable with, but know that you're the only one that I have right now. And I realized that at that point I could make a difference, and I could make a big difference with small tasks. So I went home for the summer, kind of debating what I wanted to do. And at that point, my grandma had a huge decline due to Alzheimer's. And the family wasn't ready for her to go to a skilled facility yet. So that since I had worked with people in their homes, they had a brilliant idea that I should spend the summer with her. And at that point, I now had experience with somebody whose mind wasn't working at full capacity. So I kind of saw multiple angles and realized that healthcare was where I wanted to go. So I took a CNA course at LTC, Technical College, and started working in various facilities that had mentally challenged adults. And that was somewhere that I really enjoyed working. I worked through a couple of facilities, but everywhere that I worked, the nurses did the paperwork and the CNAs did the hands-on care. And that's what I really loved. I loved working with the patients. So I really had a hard time at that point deciding to go further. And then in 2006, I actually started working at Aurora in the hospital as a CNA, and it was a different world. I noticed nurses are doing the same bedside care. They're working with the patients. It's not just about the paperwork anymore. And so I decided at that point to go back to school. So I went to NWTC. I got my associate's degree in nursing, and I was given the option of working on the cardiac floor or the neuro floor at that time. And at that point, I just wanted a job. I really didn't have a preference. So I took the neuro floor because it was day shift. And I started working with stroke patients and patients after surgery, brain and spine, seizure patients, patients after trauma to the brain or spine. And I really started to enjoy what we were doing because I felt like we could make a difference with some of these patients and really restore their quality of life. So in 2011, the hospital offered a program where they would pay full tuition for nurses to get their bachelor's degree. So I looked into several classes and courses, and I looked locally, and I really wasn't finding what I wanted. I needed to work within my full-time job because I couldn't afford to go part-time. I had 2 kids at the time. And so I found Grand Canyon University. So it was a completely virtual course, and it was done within 18 months. So when I looked at that, I felt like that's where I could continue my path on my career. Really didn't change where I was working. I still worked on the neuro floor. I still worked with the same patients. But throughout those years, I actually found that I really loved stroke. And the reason I found that was, again, going back, I always wanted to teach. And I found stroke, up to 80% of strokes are preventable if we get people the right education. So when I'm educating my patients, I'm not just educating them, I'm educating the families as well. And you start to see these people go, oh, well, I can change that too. And so you're affecting not just one person, but a chain of people. So in 2015, the American Association of Neuroscience Nurses released this stroke certification for nurses. It's 180 questions based specifically on various phases of care within stroke. So I like education, I'll go get a certification. So I went back and I got the certification so I can put some titles behind my name, letters behind my name. And that didn't change anything in my job, but it made it easier in 2016 when Aurora was looking to towards the path of comprehensive stroke center, that they wanted somebody who had that specialized knowledge. So I had kind of prepared myself for that, taking the certification early. And so then in 2016, I took the position initially as a stroke navigator. And then the following year, they decided they wanted to be a spine center of excellence. So they asked if I would roll that into my title, knowing that I loved patient education, patient care. And of course, you take on all kinds of things. So in 2016, I then became a neuroscience nurse navigator. And then in 2019, they decided that I should oversee the neuroscience program in addition to just working within it. It was easy to keep the title because it really encompassed what I did already. It added in a couple more policies, protocols, and procedures. But in order to oversee a program, you do have to have your master's. So because I had great success at Grand Canyon, I called them September 5th of 2019, just to get some information. And by September 18th, I started the program. So I am looking at a 2-year program for my master's at Grand Canyon with a graduation of May, hopefully. So that was kind of my path. It was very slow, but each piece was important. So what do I do besides overseeing the stroke and spine program? I touch a lot of different areas within the hospital. So most importantly, I'm still assessing patients. I'm still seeing my patients daily. From the time they arrive in the emergency room to some of them I call up to 90 days after they leave. If they still have needs, if they still have questions, they have my information and I'm able to be contacted. It's really important that I'm engaged all the way from the beginning, helping with treatment options, helping staff understand all of that. So it's really important with patients. For me, it's always been about the patients. The not so fun part of my job is the monitoring that we do. There's a lot of government standards that we have to meet within the stroke and spine programs. For the stroke program, there's 45 metrics that I have to watch on each patient. Thankfully, spine only has 18, so not as many there. But on each patient that comes in, I do have to go through charts, documentations, meeting with them to make sure that we're meeting those standards. And then annually, we have surveys from the governing bodies. So it's a lot of work to prepare. You have staff to prepare, documentation to prepare, and then they're within your building for 2 days for each survey. So a little bit of work there. And then it was interesting when I was putting this together, I didn't realize how much my initial choice of education carried through my career path, because really what I do now is I educate. And that's what I want to do. That's where I enjoy it. So I'm educating patients and families at the bedside, from the time they come in to the time they leave. Even after they leave, we 2 years ago created a new stroke booklet that I have patients pull out, and I'll have them refer to specific pages to help them. And actually this year we just created a new spine booklet. It actually just came out last week. So something for me to talk to spine patients with as well. And then everything in medicine is evidence-based. So anytime any new evidence comes out, we're educating doctors. All of my nurses who work within my neuro program have to go through an 8-hour neuro day with myself and my partner to make sure that they're ready for those small nuances that do happen within the stroke population. And then the community. We have a huge community footprint. Yearly, annually, we do outreach with the gamblers. We've done 5th grade education. This year, we actually just started doing virtual 5th grade education. So we have a little bit of a learning curve with some of that, but we get to still meet and we get the information out. And the biggest one is really that community within our stroke survivors. They have their own unique perspective. They're very engaged. We have a stroke committee that we meet monthly with our survivors, and we really engage them. So in the pictures I have here, it's a group of stroke survivors at our community day, and then the gamblers, actually one of our stroke survivors got to drop the puck at our stroke event. So it really is about engaging and getting the information out there. And then through all of it, the theme really is collaboration. We are a site here that we have 4 hospitals that send primary patients to us. So I collaborate with their stroke coordinators at each of those facilities, making sure that they're also meeting metrics and standards. And then making sure any new evidence that comes out, we go through. So recommendations, I hated having to go through all my math, and I was like, why do I need to know math later on? Let me tell you, in healthcare, the most critical medications you give are weight-based. And of course, they're not in pounds, they're in kilograms. So first you have to take your weight and you have to get the kilograms off of it. And then you need to be able to figure out what the right dose is, because those are critical and actually can cause adverse effects if you're wrong. So it's really important that math is a big focus, as well as science. Understanding how the body works and the pieces within it are extremely important. But most of all within nursing, you really have to have that compassion and you really have to want to help. I know we've had several students come through and make comments that they do it for money, and that becomes upsetting because we're here for our patients and we're really here to advocate for them. Thank you. So this is our spine team, social distance with masks on. The front one is one of our neurosurgeons who also goes up into the brain to retrieve clots. So we're very grateful to have our team with us. Everything we do is a team.